Geoffrey, first of all, thanks very much for...
No, you're welcome.
So just tell me a little bit about Geoffrey. So what is it you do?
I'm retired now, and my hobbies really, I guess, are gardening and toy theatre productions.
So how long have you been coming to this practice?
Probably about 5 years now. Started like most people with National Health, went private about 15, 20 years ago.
Yeah.
And a couple of people in Croydon I had, but this is a different class. You know, they are good private dentists, but Tom's and his staff here are a different class completely. In talking to Tom anyway and seeing what he's doing and how authoritative he is on the most leading edge technology at the moment for dentistry, and the way he commits himself to continuous personal development, so he gets his own training and his staff trained every year, and he gives you that immense confidence that he is not only articulate about what he does, he tells it to you in the right language so you understand it, but you can see from the rooms that he has everything in place to give you the best possible experience.
Yeah.
The reception staff are also trained nurses, and you know that is, to me, is a great thing to have.
And have you had a lot of dental treatment in the last 5 years?
Oh, it's covered tooth veneers, extractions, it's covered root canal treatment, and most recently implants.
And do you mind me asking whereabouts you had it?
It's upper and lower.
Right.
Yeah, where there was already a gap.
Yeah.
From some years ago.
Right.
Yeah. I have a trouble with the jaw pain, and one wonderful thing about Tom is he looks at that and finds out why you have a trouble with the jaw pain.
Yeah.
Is it something that, you know, it's musculocranial type work that you have to do, or is there something more underlying? And he found that because I had several gaps, there was too much pressure on one side of the jaw and not enough on the other.
Yeah.
And since the implants, that the actual pain and the discomfort has actually reduced and almost gone. So he actually looks at the underlying cause of what you're saying is a problem.
Was that painful, that treatment?
No more than any dentistry. You think it's going to be really painful and you believe it's going to be, but with Tom and with the staff and the other professionals he uses, they're aware of every motion that you make. If your finger twitches, if your hand moves, they know, they stop, they ask if you're all right. So that is really reassuring. Normally when I used to leave a dentist, I used to feel really relieved. I couldn't wait to get home and have a coffee. But now it's a feeling of normalcy. So, you know, the normalcy of it is that I feel as good as I did before.